So next I'd like to introduce you to Dr. Doug Diario. And let me do up here. I got you.
Thank you for having me. We were asked to talk about how microcirculation affects our practice, a little bit about who we are and what we do. And instead of going over my whole practice, as you can see, I've gone through lots of different trainings and continue wanting to learn all kinds of alternative methods of taking care of patients. I think my practice has really had three changing moments in it. First, when I was in my sports medicine fellowship, I was trained in acupuncture, manipulation, and myofascial release. So when I came out as a doctor, I was already focused on wellness, health, and from a musculoskeletal standpoint in treating injuries. The second was about 13 years ago, and I thought I was a pretty healthy guy. Did marathons, half Ironman triathlons, did a bunch of stuff, and then all of a sudden I got diagnosed with thyroid cancer. So I had thyroidectomy, radiation, treatment, and they said, hey, we didn't get it all. So went back, had a radical neck dissection, took everything from my ear down to my aorta on the left, and my thyroglobulin 4 months later was still positive. So I embarked on looking at every single alternative treatment out there, focusing on nutrition, exercise, stress reduction, health, wellness, aromatherapy, you name it. Went through it, worked, changed my lifestyle, and by the grace of God, I'm cancer-free. And I think the third practice changer in my life has been Bemer, and I think Judd here, my good friend who introduced it to me, and it's been such a great tool to add to my repertoire of tools to kind of help take care of patients. When you're the acupuncturist, as Josh can attest to, and you do functional medicine and alternative medicine, you have all kinds of tough problems come to you. So I get the tough nerve problems, I get the tough muscle problems, I get the tough joint problems, and I get the idiopathic problems, which idiopathic means we don't know why. I say it's because doctors are still idiots on some things, we don't know. But these problems come and try all kinds of approaches to get people better. And it's just been a great adjunct as I've been able to treat people with Bemer, and they've had great success at feeling better. So I look at it as a wellness tool, and not everybody in America agrees with thinking about health and wellness and just feeling good. But boy, if you can give people more energy, better sleep, thinking better, and get rid of their discomfort, what a wonderful thing. We can all walk around feeling better. But the second part, and probably why I'm here as a sports medicine physician, I've been lucky enough to take care of Division III colleges, Division I colleges, and even professional athletes, is the performance component of it. I thought, hey, I'd put up the formula for VO2 max, and endurance. We always talk about, how do we improve endurance? But I'll just say this, the rate limiting step for any endurance athlete is transfer of oxygen at the smallest blood vessel to their tissue. And if we can open up those small blood vessels, you're going to increase their circulation to their muscles, and they're going to get better, and they'll be able to perform better. And secondly is recovery. We see baseball playoffs are going on now, and these pitchers have to recover, turn around, pitch again in 3 days. And if you think about delayed onset muscle soreness, all that muscle we get sore after we do some new activity that's 24 hours later, that's all about toxins and breakdown products, lactic acid we call it, in the muscles. And if we can get that out of the muscles, we can reduce soreness and we can get back to working out better. Me personally, I've seen great success with this, with my patients and with myself. I feel like I'm working out harder, and like I'm 30, I'm running times that are a lot faster and strength a lot better. So I just have had great personal benefits from the Bemer, as well as benefits with my patients. And then lastly is how I use it in my practice. I am actually an employed physician of a hospital system that does not allow me to use it in my practice. So I have got permission to do it as an outside source business. And so I introduce it and get people's emails, phone numbers. I email them stuff, and then give them my cell phone, and we start talking about it, and I add it as an adjunct tool outside of actually in my office. Thank you.